The Golden Eye. Let me tell you a story of an intraocular gold foreign body inside the eye for 28 years. Back in 1994, while working in a jewelry factory, a goldsmith had an accidental injury while preparing a small golden ball. It burst due to overheating and struck in his left eye. Then he immediately visited a local hospital and was treated with medication and bandage as they didn't found any intraocular foreign body. Time passes by and eventually in 2003 it was discovered that this patient had an intraocular gold foreign body in his left eye. After 2008, the patient gradually developed dimness of vision, and in 2023 patient visited us. Patient came with a vision of 3 by 60 in his left eye. Slit lamp examination revealed conjunctival congestion, diffuse corneal epithelial edema, and descent folds in the cornea from 5 o'clock to 10 o'clock position, involving the pupillary axis of the left eye. It also showed a bright gold colored foreign body at 6 o'clock position in the anterior chamber, with no entry wound anywhere in the cornea and no iris defect. Gonioscopy revealed multiple tears and scarring in the descent membrane around the location of the foreign body, suggestive of mechanical trauma to endothelial layer and descent membrane due to the sharp edges of the foreign body. It also shows the irregular pigmentation in the trabecular meshwork and a broad synechia near the foreign body, but there are no defect in the iris or iris roots. High-resolution anterior segment optical coherence tomography shows descent membrane folds and a linear, highly reflective structure of 1.89 mm in size with marked posterior shadow obscuring the structure below, and the anterior chamber depth was 3.02 mm in left eye. The cornea is millimeters with multiple descent fold is also noted. UBM shows a highly echogenic substance in the inferior angle of the anterior chamber over the iris, with reverberation echoes seen posteriorly to the foreign body. The axial section of the non-contrast CT scan of the orbit showed a high-density image with blooming artifacts, suggestive of a metallic foreign body present in the anterior part of the eyeball. The coronal section of the NCCT shows the metallic foreign body is situated in the inferior part of the eyeball, but due to blooming artifacts, the integrity of the scleral wall or cornea cannot be properly visualized. So we plan to proceed for the foreign body removal with phacoemulsification and DSEK. After marking the center of the cornea, a diagonally opposite point is marked for the entry. A port is made with the help of side port. Another side port is made at around 90 degrees from the main port. Viscoelastic substance is given. An end-grasping forceps is introduced from the port, grabbing the foreign body, extracting out it from the anterior chamber. The size of the foreign body is measured on table, which was 2.5 into 2 mm in dimension. A 7.5 mm diameter trephine is used to mark the descemeter axis prior to the cataract surgery. Trypan blue is given and waited for 1.5 minutes, which will help to dye both anterior capsule and the descent together. As the descent membrane got stained, lower part of the cornea shows endothelial damage. Under retroillumination, continuous curvilinear capsular axis is done. Then the phacoemulsification is performed. After thorough cortical wash, a foldable single piece intraocular lens is placed. After that, visco wash is done and pilocarpine is given. After constriction of the iris, a surgical PI is done at around 9 o'clock. And with the help of Reversinsky hook, desmetorexis is performed. The intact desmet is pulled out with the help of Macpherson forceps. After checking the intactness, an air is given into the AC. Now the lamellar dissection is done in the artificial anterior chamber. And the donor cornea is being prepared. Now this donor tissue is introduced into the anterior chamber with the help of needling technique, and the graft is attached with the full chamber air tamponade. Postoperative 3 months, the visual acuity was 612 unaided. Gold intraocular foreign bodies are uncommon. Till date, only 2 cases have been reported, and this is the third one. This kind of rare incidents can occur due to occupational hazards such as industrial activity and metal processing or explosion. So protective eyeglasses should be promoted for the public awareness. Thank you.